Hello, this is Dr. Anthony Arium. I want to talk about circumcision. Circumcision is one procedure that many take for granted as a minor procedure, but has led to major complications in many children, leading to major corrective surgeries that may be done repeatedly. Circumcision, as you all know, is the removal of the excess skin of the prepuce covering the tip of the phallus of male children. Let me use this medium to make it clear that circumcision is not recommended for baby girls. So, nobody should make you to circumcise your baby girl. Having said this, for the baby boys who should be circumcised, there are conditions for which, if seen in a baby boy, circumcision should be withheld until corrections of those conditions are done. If your baby boy is born and the tip of his phallus is looking any different from the usual rounded penis with a pointed tip, please do not circumcise that child until he has been seen by a pediatric surgeon or a pediatric urologist. Some children are born with what we call hypospadias or epispadias. To a layman, the tip of the penis is as though it has been slit by a scissors, either from the tip downwards or from the tip upwards. This makes the penis tip not to be rounded as in other children. Why is circumcision in these children not advised? These conditions require surgical correction, and the best material to be used to reconstruct this penis is the excess skin that is cut off during circumcision. Other materials that can be used are secondary when this preputial skin has been lost. The best spare part, naturally, which this child have for the correction of the shape of this penis and where he is passing urine from, is the skin that is cut off during circumcision. So if you circumcise such children, you have limited the chances of their having the best correction ever. So before you circumcise your child, ensure that a health professional has examined him to confirm that he doesn't have any of these conditions for which circumcision is not advised. Another point I wish to highlight about circumcision is that though it may appear simple to many, even their neighbors who has no medical experience has been circumcising children from time immemorial. Well, you may not know how many of the children attended to by this your neighbor may have ended up in the hands of pediatric surgeon or pediatric urologists with repeated reconstructive surgeries to correct damages that were done. One of such complications is abnormal opening on the pipe that conducts urine to the tip of the penis, so that when the child is passing urine, it's coming from under the penis and from the tip. Correction of this is a major surgery and may even be done more than once. From my experience, we've also seen people whose tip of penis were completely cut off, and to children who have some bleeding disorders. Some have bled to death from what you take as simple circumcision. You see, as simple as it may appear, it is important that you have your child circumcised by someone with the right expertise, who also know when to and when not to circumcise. Please, let us not endanger our baby boys by taking them to just anyone who claims he can do circumcision. You may save a little money by getting it cheaper, but in the long run, you may pay dearly for the complications that may follow. And in few instances, some children have bled to death from complications of circumcision. This underlies the importance of discussing this to awaken you to the dangers that may occur with this and why it must be properly done. And this is Dr. Anthony Arium, adding to health and social literacy. Thank you.